Communicable diseases recognize no boundaries, for they've taken their toll of human life the world over. Every year, hundreds of thousands of people suffer.
A communicable disease is one which can be caught from someone else.
Viruses, and there are many different kinds of them, can be scattered with each particle of saliva and mucus.
The classic example is the 1918 influenza pandemic, which was first recognized in Boston and within a month spread throughout the entire country. Today, always watchful for epidemics, practicing physicians constitute the first line of defense, and many die unnecessarily from preventable infections.
Oh,
Okay, now I can hear you.
yep. Awesome. Hi.
Oh, cool. Hi, how are
Hi.
you?
I'm good. How are you?
Excellent.
So I've got a couple questions for you. Can you first tell me who you are and what you do?
Yes, my name is Laura Poggel, and I am a pediatrician that only works in a hospital, and I work in a hospital in Roseville, California.
Can you give an overview of the duties and functions and responsibilities of your job, just kind of what a typical day looks like?
The hospital floor that I work in has 36 beds, and they would be occupied by infants and children, anywhere from a few days of life up to age 21. And when those people are hospitalized, I would be the doctor caring for them on the hospital service. And then when they're well enough to go home, they're cared for by their doctor.
Is your job what you thought it would be when you started?
Yes, but maybe that's because I wasn't sure what I wanted to do when I finished my training. And so I was a traveling doctor for a few years, and half of the time I worked in the hospital and the other half I worked in an office, like many pediatricians do, giving shots and regular pediatric care. And I was very much drawn to the hospital side of things. And it allowed me to get a picture of what I would be experiencing, so that by the time I took the job, I knew that I would love that.
Are there busy and slow times, or is it fairly consistent?
Very much busy and slow times in pediatrics, because many pediatric illnesses are seasonal. Like influenza tends to impact us in the winter, and another virus that's very common for pediatric patients is called RSV, and that also is very active in the winter. So that is a very busy time, winter and spring. And then summer tends to be less busy in the hospital.
How has your workplace been affected by COVID-19?
Oh, very interesting. So one thing we've learned about the virus is it tends to spare pediatric patients, meaning the pediatric age group is largely unaffected by this, or very minimally affected. There have been very few pediatric deaths, and pediatric sick kids, like you hear about the adults being on ventilators for a long time, that's very uncommon in pediatrics. So actually, we have not had a lot of what you're hearing about in the news as it pertains to COVID, but I will say that what it has done is create a bit of a culture of fear. Honestly, in the workplace, people are very, very concerned about acquiring the virus. The uncertainty that you see in the media also pertains to healthcare, because there's been so many shifting packets of information and how to protect healthcare workers and how much equipment is available, that has definitely impacted the way that people approach the job.
What have been your personal concerns about working in the hospital during this pandemic?
When nobody knew how prevalent it was going to be in our community, I was most concerned about bringing the virus home to my family, when I really thought that it was maybe more likely to be a very rampant epidemic in our local community. And I think that because we've seen less in our community, as well as in my pediatric area, I think the concerns honestly have been more along the lines of feeling part of healthcare, but not maybe part of what everybody is experiencing. I thought actually I would get the virus and then be immune and be able to help out wherever, and now that's not the case. And so it just feels a little bit like being on the sidelines, and most physicians don't have that type of attitude. We want to help and step in. And so the concern has really been feeling like I'm not doing enough.
What kind of precautions do you take when you get off of work and go home?
Oh, that's a great question. Largely due to my husband, who developed the sanitization protocol that I will describe. I shed my clothes in the garage, and we have a laundry room that is right there adjacent to that. And so I throw them all in the laundry and wear a robe, and then go take a shower, and then come back and put the robe in and don't touch everything. And then he comes by with a can of something that smells horrible and disinfects. And then I tend to use alcohol to clean off like the door handles and things that I've touched. And it's been interesting because some of my group that I work with does that anyway, like every day that they come home from work. And it's been interesting to find out the different ways that we handle germ exposure that we were exposed to before COVID. I mean, influenza and RSV are big deals. And so some of my colleagues have been doing what I'm doing now forever.
What are your thoughts on quarantine and how long it should last?
Well, that's the $1 million question. I've always felt the tension between the economic effects and the emotional effects of quarantine and the health effects of quarantine. And I think it's very clear that quarantine works awesome to containing the virus, but we knew we would see, and we're seeing, is the economic effects and the effects on people and families and health and systems on being isolated from each other. And I don't know the real answer to your question. I think the tension that I'm seeing between all the different levels of government, it's going to be a really hard question. In areas where it's a bit less prevalent, you do wonder about opening things up with some distancing. And I kind of think we're at the point where we should consider that. I certainly have felt that way with respect to our family. I do think that the flattening of the curve has largely been achieved. And so it seems like maybe it's time to open some things up, knowing that we're not going to overwhelm healthcare with a huge bolus, but we will see some more cases. But I still think it's probably time to consider doing that.
How do you think this pandemic has affected or changed the medical community?
One thing that I do wonder about is for going forward, will people have a little bit better idea of how we should be educating about preventing viruses that come every year? Influenza comes every year. And this virus, SARS-CoV-2, which is the cause of COVID, I think should really make us aware that the same spread happens basically with influenza. It just doesn't have the same number R naught, or the number of people that it attacked. I would hope that going forward, the medical community will educate, and that this will remind us that those same precautions really should happen for those regular viruses. As far as some of the broader things, there's some concerns about healthcare because it's been super expensive to ramp up for this, and many small hospitals have ramped up for this and then not seen the patients. And so I think there's going to be some interesting times as we go forward economically in healthcare, which I have some concerns about. I also think one thing that has happened, all the operating rooms are shut down, all the elective procedures are shut down. And I feel like what's going to be interesting is how does that reopen? And do you have to wait for procedures? And how do we distribute the healthcare that's now compressed into a time frame? I think that's going to be interesting and weird.
What are you most looking forward to once the quarantine is done, or most of the scare is over?
Family gatherings. Definitely, without a doubt. The hardest thing is, as you know, we have a family that tends to get together, and I value that highly. And I like that open door house, and I really look forward to those doors opening up again. That is the one thing that I've missed. I'm not actually extremely social outside of family and work. I get most of my social needs met through my wonderful colleagues who I genuinely love, and through my family who I genuinely love. So the rest I haven't noticed so much, but other than that, I just really missed our family gatherings. And that is the one thing that I just am really excited to resume.
Well, thank you so much for doing this interview with me.
Well, you had very insightful questions. It was a pleasure.
As individuals and as a community, we can do many things to halt this movement of germs and prevent the spread of disease.